Hi everyone, my name is Emily and this is my presentation about quad testing in pregnancy. Quad testing is a blood test that is used for genetic disorder screening early in pregnancy. It screens for neural tube defects, trisomy 18, and trisomy 21. This measures 4 different components of maternal serum markers: AFP, alpha-fetoprotein, which is produced by the baby's liver, HCG, which is a hormone produced by the placenta, and UE3, unconjugated estriol, which is produced by the baby and placenta. Additionally, it also screens for inhibin A, which is produced by the placenta and the ovaries. Quad screening occurs between weeks 15 and 22 of pregnancy. It is best performed between weeks 15 and 20, but it can be done up until 22 weeks, and it is offered in the second trimester for women who did not undergo first trimester aneuploidy screening. A brief overview of the test includes 2 studies that were both done in 1984 by authors Merkatz, Macro, and Johnson, and Huckel, Wald, and Lindenbaum. These studies both investigated the significance of alpha-fetoprotein in pregnancy and how that was associated with different conditions such as trisomy 18 and also Down syndrome. Since then, pregnancy screenings have been evolving and continuously improving, having a lower false positive rate and a more prominent sensitivity rate. Current recommendations supporting the quad screen. The American Pregnancy Association recommends the screening for a variety of different individuals, including individuals with women with a history of birth defects, women 35 years or older who possibly used harmful medications or drug during pregnancy, have diabetes and use insulin, have had a viral infection during pregnancy, and have been exposed to high levels of radiation. American College of Obstetrics and Gynecology believes that all patients should be offered screening tests and recommends quad screening in certain clinical situations, such as an isolated soft ultrasound marker where aneuploidy screening has not been performed. The authors of our textbook, Schwedewald et al., the 2020 Primary Care Woman, recommend the quad screen for women who initiate prenatal care later in their pregnancy or when access to specialized neural tube ultrasound is not readily available for women in pregnancy. The sensitivity of the screen, the neural tube defect detection rate is almost 100% for encephalopathy. False positive is around 2 to 5%. Open spina bifida detection is 85 to 92%, with a false positive around 2 to 5%, and sensitivity for Down syndrome is between 79 and 81%, with a false positive around 5%. Indications. It's currently offered to all pregnant women presenting for prenatal care prior to 20 weeks of gestation. The American Pregnancy Association also recommends screening for patients with certain medical conditions such as diabetes and insulin use, previous history that indicates having a child with birth defects, and being 35 years and older, among other things. There are currently no contraindications to receiving this test. It is a blood test, and the mother should be informed that they do not have to participate or do it. The procedure consists of a very small blood sample that is taken from the mother to measure these different serum markers. From that blood test, the results are then combined with different risk factors from the mother, such as weight, race, gestational age, to determine the likelihood of having an affected fetus. This is done using an algorithm. The gestational age is actually extremely important. If there is an abnormal test result for the estimated gestational age, then an ultrasound is obtained to confirm the gestational age, and the test quad screening is redone with the updated gestational age. The raw value from the serum is converted into a multiple of the median, which is then comparable to a standard deviation and is used to compare results, ultimately providing the results of the screening. Some advantages for this test is that it is widespread and widely available. It screens for genetic disorders including Down syndrome and neural tube defects, and mothers can make an informed decision about their pregnancy and how best to proceed. Some disadvantages is that it occurs later in pregnancy, which can lead to a later diagnosis. It is a screening test, not a diagnostic test, so many women who get a positive screen have an unaffected baby, and it can cause unnecessary anxiety in expecting mothers. So a normal or negative test result for the quad screening means that there is an expected amount of the AFP, UE3, HCG, and DIA. The fetus is at a lower risk of having the disorder compared to the general population. Normal screening results do not rule out a possibility that the fetus might have a genetic disorder, and no follow-up is necessary. With an abnormal result, there are several different options. Neural tube defects can be shown with an elevated AFP. Trisomy 21 or Down syndrome can be shown with a low AFP, low UE3, and elevated HCG and DIA, and trisomy 18 can be shown with a low AFP, low UE3, and low HCG. Following any of these abnormal results, patients can make a follow-up with their obstetrician and make an appointment with a genetic counselor to receive counseling on what this means and what options they have. If the patient wants, they can also undergo targeted ultrasound or amniocentesis for some more diagnostic screening. Client teaching and counseling. The most important is that this is a screening test, not a diagnostic test. There is a chance you can get a positive screen but have a perfectly healthy baby. Alternatively, there's a chance that you could have a negative screen and have a baby with one of these conditions. Most women who do have abnormal results do end up having perfectly healthy babies. The screening is not mandatory and patients do not need to do it. And finally, these are my references. Thank you.